Good afternoon. I think just on a lighter note as we get started, Marion and I had two baby calves named after us, and in honor of that, I have put on this dress today. So thank you to Minister Thompson, who named two calves after us yesterday. So today, across Canada, we're seeing increasing numbers, over 3,000, well over 3,000 cases of COVID-19, and as of last night, there were 35 deaths. 2.6% of those cases have been in our intensive care units in the country. P.E.I. now has a total of 5 confirmed cases of COVID-19, and 1 is considered recovered. I expect this number to grow here in P.E.I. in terms of our cases and our hospitalizations. We continue to talk about the importance of having to flatten the curve and minimize the impact on our system, on our families, on our communities, and we'll continue to talk about that every day. In terms of our contacts of our 2 newest cases, they have been followed up by public health nursing, and the 4 cases that are that we talk about that are at home and doing well with mild symptoms. And I do want to make something a little bit clear for as we go forward and expect more cases. I think we may want to share information about those cases in a slightly different way and identify them as having international travel, interprovincial travel, or community spread. And I think that's going to be important to know going forward. And also, I mean, Prince Edward Island is uniquely small and tight, and we want to, as we go forward with more cases, be able to respect the privacy of those individuals. But I certainly understand, and just as other provinces did in the first cases, give some detail about the international travel related to those cases. Flight information will still be posted online, and that is going to be coordinated, as far as I understand, nationally as well. As of 8 o'clock this morning, there have been 556 tests conducted and 339 negative test results. We have other test results pending, of course, and other testing being done this morning and all day at the clinics. Yesterday, we started doing working with our enforcement colleagues to follow up complaints about people who are supposed to self-isolate and who are not. And so if people have concerns, please let us know through the 1-800 line, and we will do our best to follow up. Also, because we mentioned it yesterday, the essential services list has been updated, and we've looked at what has been named essential services across the country, and is, as best as possible, trying to be consistent with the other provinces. A decision regarding schools. I know we have many parents that are awaiting news about how long school may be impacted, and we expect that kind of decision as well as other government workers before the end of the week. So we will be making that decision based on our epidemiology and some modeling that we're doing about the illness and how it will impact islanders. I do want to take a moment to clarify some what I think is not a misrepresentation of the facts by media with respect to the decision to close certain liquor stores in Prince Edward Island. And let me be clear, as a physician, I care for and understand alcohol dependence that many islanders struggle with. I would also say that There would be barely a family that has not been impacted in some way by acute alcohol disorder in this province, including my own. So there has always been access to alcohol in P.E.I. Agency stores and breweries remained open to ensure islanders in need continued to have access to alcohol so they could manage their disease safely. And the decision to close some of the government-owned and operated stores was made in concert with government to allow them the time, as was explained earlier in the week, to put appropriate precautions in place for the safety of their staff and the public. During this already stressful time and with rapidly changing information coming at us every moment of the day, I want to make sure that the media reports on this topic remain accurate. It's also a time when we need responsible information as much as we can, especially when public health and public safety is paramount. We've talked about flattening the curve and how important it is. This virus is a pandemic. It was named as such by the World Health Organization. It is a serious illness for many people who are older and who are immunocompromised, who are underlying health conditions. They will be impacted more. Our health system will be impacted, and we are doing these measures because we are taking it seriously. Islanders will be impacted, and our system will be impacted. So I say it every day, and I want to continue to stress the importance of staying home, of self-isolating after travel, and of practicing social distancing when you need to go out for essentials. We are so thankful every day for our essential workers, but our best way to thank them is to stay home as much as we can. And the simple act of staying home can make a big impact when it comes to protecting yourself, those who you love, and especially those who are most vulnerable. The choices we make today will influence the days and weeks ahead. Merci. Thank you.
Good afternoon. I'd like to continue to thank Islanders for their cooperation and understanding as we provide essential services and adapt our care areas to be prepared to receive additional COVID-19 illness. I want to build on Dr. Morrison's comments to make sure the public understand how important it is to follow those guidelines and to inform healthcare providers when they're seeking treatment about their status of self-isolation or travel history. This provides our staff with crucial information to ensure they are protected and that other patients are protected from potential exposure to COVID-19. For Islanders needing health services, we do have options in place for appointments by telephone for individuals who are self-isolating or practicing social distancing for their own health. This includes mental health supports, which are available online on the Health P.E.I. website. People can call in for support, and our staff are reaching out as well for programming in the community. Through home care and their essential services program, they have adapted to work in protecting their vulnerable patients through calling and doing assessments over the phone, as well as answering questions or concerns. They're limiting their personal interactions if it can be safely done to meet the client's needs. This may be the preferred option for many patients, such as seniors or most vulnerable with immune-compromised or other chronic conditions. Our most important resource in the health system to this response is our people. One of our most concerning areas for the Joint Response Team, and we know for our staff and physicians, is the appropriate and effective use of personal protective equipment. To date, we have adequate supply of essential personal protective equipment to be used in appropriate healthcare settings. But this resource is one that we need support from everyone in our system and beyond to be responsible for. We're aware of the staff concerns, and we've approached the management and use of those resources carefully. We're accessing new sources for supplies and extending the life of our existing supplies. And we will continue to do everything within our ability to have the supplies we need as we face this pandemic. This includes reaching out with other provinces and the federal government for emergency assistance if needed, if we face increased critical shortages. I want to give you a little bit of information today on the National Emergency Strategic Stockpile Clinic that Dr. Morrison mentioned yesterday. It's now in the process of being set up and will be ready to go in the next day or so. It'll offer a cough and fever clinic for Islanders, and this clinic will be available by appointment. The Charlottetown screening and testing location will also be moved to be co-located with the cough and fever clinic, and it'll be set up as a drive-through option to increase our capacity for testing, as well as a means to conserve our personal protective equipment. I will offer more information as the details of the clinic are finalized and make sure that we have people knowing tomorrow how they can access those appointments for the cough and fever clinic, and we'll be publicly making that information available so that Islanders know how to access our screening and testing sites as well. Thank you.
Thank you, Marion. So, juste en français, quelques minutes. Il y a maintenant bien plus de 3000 cas positifs de COVID-19 à travers le pays. Et hier soir, il y avait 35 morts. Et le taux de cas à l'île est rendu à 5. Comme je vous ai dit hier, on n'est pas sorti de l'auberge. Je m'attends à ce que ce chiffre augmente. Les services infirmiers de santé publique communiquent au quotidien avec les gens qui ont été en contact avec les 2 nouveaux cas d'hier. Et depuis 8 heures ce matin, il y en a eu 556 tests de réalisés et puis 339 résultats négatifs. Et on tente les autres tests, mais on est en train de aussi faire plus de tests chaque jour. Je répète aujourd'hui la consigne de rester sur votre terrain pour ceux qui sont en auto-isolement. Mais il est toujours correct de sortir dehors pour rendre de l'air. Mais pour les personnes qui sont en auto-isolement, il faut rester sur votre terrain. Aujourd'hui, demain et le lendemain, je vais continuer à répéter l'importance de rester chez vous. De l'auto-isolement après tout voyage, de pratique la distance sociale lorsque vous sortez faire vos courses essentielles. On est tout le monde reconnaissant pour les travailleurs essentiels et la meilleure façon de dire merci, c'est de rester chez vous. Rester chez nous. Ce simple geste de rester chez nous peut faire toute la différence quand il s'agit de se protéger nos proches et les gens vulnérables. Les décisions que nous prenons aujourd'hui vont influencer les jours et les semaines à venir. Merci. Thank you. Open it up for questions.
Nicole Williams, CBC.
Hi, Dr. Morrison. I realize that you're going to be putting these online, but can you tell us a little bit more about how these 2 new cases came to P.E.I., how they traveled back from international travel?
So both cases, one traveled into New Brunswick and one traveled into Halifax, and they came by, they did not take public transport back to P.E.I., they came in private vehicle. So anyone that was in their vehicle, for instance, would be identified as a contact, and they will be followed up by public health.
And what are the flight numbers?
I actually didn't even write them down because I know that they will be going up on the website, and but we have notified the Public Health Agency as well as Nova Scotia and New Brunswick, and they should be up by the end of the day.
And just to clarify, the recovered case are they now social distancing?
Sorry, I just missed the first part of your question.
Oh, that's okay. Sorry. the recovered case, I assume that's the first case that we found out about. I'm wondering if they're now social distancing, they're no longer in self-isolation.
That's right. So after those with mild illness who are doing well and who haven't been in hospital, and if they're not a healthcare worker, they would not have to stay in self-isolation anymore, but like everyone else who's not in self-isolation should be practicing social distancing, and that's very important for all of us to be doing.
And just one follow-up question for
Jim Davis.
Yes, good afternoon, Dr. Morrison. I'd like to know how the reopening of the Oak Tree Place liquor store is playing out, and depending on the success or failure, will you be giving any consideration to reopening any other businesses or services under strict health protocols or safety protocols?
Thank you. Hi, Jim. So I think we're always trying to balance that safety of the Islanders and the public and the staff, recognizing, as I mentioned, the absolute importance of alcohol for many Islanders. So I think they'll be looking at what can be done, what are the options that are safe for all involved, and where the need is. I think the agency stores, of course, have always been open, and as well as the breweries, and they will remain open. And then I think they will look at the volume, how it's going in terms of being able to maintain that social distancing and safety of those coming into the store or and in the store. And I think that's exactly what we need to look at and continue to look at as we go forward. So that would be a decision in concert with other parts of government as they do this, and they're trying to recognize the need and keep the health and safety of everyone in mind.
Okay, and with looking at any potential reopening of other businesses or services, is that a consideration at all right now?
I think we have actually been certainly getting more pressure on the other side to be very strict about what we would consider essential, because people should be taking this seriously. It is a serious illness, and businesses should be recognizing that. So I think it's really trying to make sure that we continue to have the businesses that are essential and the services that are essential continue to function in a safe way, and those that aren't essential, it's the safest thing for all to keep them closed for now.
Thank you.
Thank you. Sean McDougall, Eastern Graphic.
Good afternoon, everyone. I had a question for Ms. Dowling. I was asking Dr. Morrison the other day, how many retired healthcare workers do we have relicensed in the province to work now?
Oh, that's a really good question. I didn't bring those numbers with me today. We can definitely get those for you and send them. I know we have, we're definitely over or close to 100 of ones who have already been contacted and now are licensed, and they do range from physiotherapists and registered nurses, licensed practical nurses, some support staff workers, and physicians. So, but we'll have to get those numbers for you. I apologize.
Yeah, no problem. And just as a follow-up to that, are they being put back on the payroll with Health P.E.I., or are they volunteering and getting an honorarium in advance?
No, they will be, if they come to work with us, they will be paid according to the respective collective agreements or contracts that are in place for their classification of employee. So they would be part of our casual workforce.
Okay, thank you.
Thank you. Carrie Wynn Ocean 100.
Hi, Dr. Morrison. Yesterday we talked about a couple of things. I'm just looking for maybe a little bit of an update today because there have been some other things that have occurred in our neighboring province. I know we did get a number of residents from Borden area calling concerned about the bridge travelers. They're saying, they are stopped when they cross the bridge, but nothing's being done to stop those travelers from visiting the gas station, stores, and Tim Hortons. Apparently they have seen it. The callers are concerned because those travelers are supposed to self-isolate and go straight home or to wherever their destination is, but that doesn't appear to be happening. Now, yesterday, we did see after your press conference at 1:30 that the province of New Brunswick has now closed its borders to everybody except for essential travel and to residents. Is there any change in that from PEI's perspective today?
Well, I mean, we are. So I don't think there's a change, but in terms of our ongoing messaging, we want people to be staying at home. They should really only be traveling if it is essential. We know that we have a lot of people in the trucking industry going back and forth. We have people who still need to have medical appointments who are going back and forth to Nova Scotia and New Brunswick. We are very clear that we are not wanting people to go for shopping over on the mainland, and so whether we need to be even more strict, it's a good question. And we may need to do that. I think Nova Scotia has been similar to us, screening and making sure people understand the self-isolation. So we'll continue to do that. I know that New Brunswick is asking for that as well. So that's important for Islanders to be aware of. In terms of people stopping, and I know that it's been an issue on the other end of the island too, those who are supposed to self-isolate, but they may need to get gas. I mean, it's important that if you do need to stop and get gas, washing your hands, keeping social distance, really key. In terms, I know some of the places where you're able to pick up things have actually put big X's on the floor, and you are asking people to stay a certain distance away when you're paying. So I think those are really good options for businesses that are doing that and are having essential services and providing essential frontline service.
And something that you mentioned yesterday as well, Dr. Morrison, was you were, I believe, then updating, some limitations or guidance for those that may have shared custody of children. Is there any update on that today?
So we've had some. We're having ongoing discussions. I saw an email late last night with our counterparts with who are working in family law, for instance, and so wanting to make sure that they have that advice and that guidance, and so it's working with them. So it's not something that I brought forward here, but we want to make sure that when we're answering those types of questions, everyone's giving some consistent advice. Appreciating that all those individual cases may be different. So, and I think anything that we can, we'll be making available online as well. And so we'll update that, and as soon as something is available on the website, we'll let you know.
Thank you.
Okay, thank you.
Steve Bruce, CBC.
Hey everyone, question for Marion. Can you talk in as much detail as you're able about what the pandemic has meant for pregnant women on PEI, what their prenatal care looks like in the midst of this, and how it changes the rules around who can be in the delivery room, who can visit after the birth, those sorts of things?
Hi, Steve. It's a good question because there have been changes, and that's why I opened today with thanking people for their understanding. So there are restrictions in place for visiting in order to contain the spread and have people also participate in some of those very important life events like end of life or birth. So I know specifically for the obstetric group or pregnant women and families, they have centralized some of their clinic support so that the obstetrics and gynecology clinic is looking after most of those individuals in the Charlottetown area and similar in the Summerside area, to allow some of the family practice physicians and others to provide other services to Islanders. So it's that domino effect of across a number of our services that way. As far as the visiting guidelines of who's in the birthing room and those types of things, we do have some guidance in place, and that is dependent on the family situation. So if they are positive, one of the cases, and this is their situation, the procedure and process is very different than if it's someone who's self-isolating for travel who has no symptoms, and there's different ways to approach that, and it's really based on our staff in those facilities following the guidance from the public health office, but also making sure that the staff and the family is safe, as well as other patients that would be coming through those areas. So it's discussed and based on the individual circumstances of that family.
And maybe Dr. Morrison can take this. For parents, when they leave the hospital, they go back home, and if they were counting on, visits and support from family and friends with their new baby, what's your advice to them?
It's such a special time for families, but I think it's really important at this point in time that they reach out and instead of having physical visits, that do as much as you can by Zoom and FaceTime and pictures, and try to share in a different way the wonderful special experience of bringing a baby home in those first weeks, and it's not going to be like this forever, but it is the safest thing we can do to limit that contact with those people coming into the home, but also that family and that baby.
Julien Lecacheur, Radio-Canada.
Docteur Morrison, parlez-nous de la personne qui est officiellement guérie. C'est la première personne à l'île du Prince-Édouard à être officiellement guérie de la COVID-19. S'agit-il bien de la première personne qui était porteuse de la COVID il y a maintenant une dizaine de jours? Et maintenant, quel va être son processus? Est-ce que vous allez continuer à l'appeler, à voir comment elle va? Est-ce qu'elle va, à partir de quand va-t-elle pouvoir sortir de son domicile?
Après un bout de temps, après 14 jours, si elle va bien et n'a pas de symptômes et ne travaille pas à l'hôpital, elle est guérie, et puis elle est donnée juste comme n'importe qui à l'île du Prince-Édouard. Il faut avoir la distance sociale, mais quand elle était en auto-isolement, on l'appelle chaque jour, il y a du contact. Mais après ça, elle peut faire la distance sociale comme tous les autres insulaires.
Docteur Morrison, je ne sais pas si vous allez être la meilleure personne pour répondre. Peut-être que votre collègue pourrait répondre, mais j'aimerais avoir cette réponse en français. On le voit dans certaines autres provinces, il commence à y avoir, je dirais pas des pénuries de masques, mais c'est vrai qu'on commence à demander à certains médecins de limiter l'utilisation des masques dans la journée. Est-ce que c'est le cas à l'île du Prince-Édouard? Est-ce qu'on a assez de masques? Et ensuite, est-ce qu'on demande à tout le personnel de santé de limiter l'utilisation des masques à un nombre X par jour?
Et à ce moment, il y en a assez de masques à l'île du Prince-Édouard. Mais comme le reste du pays, il faut faire attention qu'on a toujours les masques, les propres masques, pour la propre raison, le propre temps. Et alors, je sais que Health P.E.I. est en train de sécuriser et d'acheter d'autres masques et d'équipements qu'il faut pour protéger à l'hôpital. Et c'est tellement important que tous les infirmières, les médecins, tout ce qui travaille le front line se sent protégé. Alors, il n'y en a pas une limite X par jour. Ça dépend les patients que vous voyez, quelle sorte de choses vous faites avec le patient, dans quelle location dans l'hôpital, et vous devez mettre des masques, et quelle sorte de masque, parce qu'il y a des masques différentes pour faire des choses, des procédures différentes. Alors, à ce moment, on a assez, mais c'est toujours une inquiétude qu'on aura assez, mais je sais que Health P.E.I. est en train de travailler très fort pour s'assurer qu'il y en a.
Merci beaucoup.
Laurent Pivot, la Voix acadienne.
Bonjour, Dr Morrison. J'aimerais juste que si vous pouviez redire un chiffre que vous avez dit en anglais, c'est-à-dire le pourcentage de cas au Canada qui sont en ICU. Est-ce que vous pouvez juste nous redire ce chiffre, s'il vous plaît?
Au Canada, de les cas au Canada, il y en a 2,6% qui sont dans le ICU, qui sont vraiment malades, où ils ont besoin de soins intensifs à l'hôpital.
Okay, and just a follow-up on that for Ms. Dowling. The other day you said that 12 ventilators will come by the end of the spring on P.E.I. I'm just wondering if they are part of the National Emergency Strategic Stockpile or if it's another stock.
Yes, it's separate from the national bulk order. So the 12 are in addition, and they're being directly purchased from a vendor that we've been working with.
François-Pierre Dufault, Radio-Canada.
Bonjour, Dr Morrison, François-Pierre Dufault de Radio-Canada. Félicitations pour l'honneur que vous a fait le ministre Thompson. Ma question aujourd'hui, ce serait par rapport à cette mini-clinique qui a été annoncée. Votre collègue en a parlé un peu en anglais. Est-ce que vous pouvez répéter en français les détails de cette mini-clinique-là? Où est-ce qu'elle va être située? Qui elle va desservir? Et comment on peut y accéder à partir de demain?
Bonjour. Alors, vous parlez de la clinique en Nancy, c'est parti on s'appelle ça le NES Mini Clinic, et puis ça va être une clinique ici à Charlottetown. Il y a un parti qui ça serait pour le drive-through pour faire les tests pour le COVID-19, mais aussi partie de la clinique serait pour les médecins, les infirmières, de voir les personnes qui toussent ou ont la fièvre. Et ça s'appelle une clinique de tousser et fièvre. Ça va commencer dans les 2 jours qui suivent, et puis ça va être les détails à propos de où et comment accéder à la clinique. Ça va être annoncé, j'imagine, demain. Ils s'organisent juste pour s'assurer que les numéros de téléphone, les emails et l'organisation est tout prêt avant d'annoncer, mais je pense que ça va nous aider de faire plus de tests, de voir plus de personnes qui toussent ou ont la fièvre, et puis les personnes qui vont là, ils ne doivent pas aller à l'urgence s'ils ne sont pas tellement malades.
Une autre question sur un autre sujet, s'il vous plaît. Pourquoi changer la façon dont on donne les détails des vols aériens que les personnes qui ont contracté le coronavirus, les 2 dernières personnes, les 2 derniers cas qui ont été annoncés hier? Pourquoi changer la façon dont on donne l'information par rapport aux avions qu'ils ont pris pour rentrer à Charlottetown?
Et puis, on va quand même donner sur l'Internet, les websites, les vols. Mais maintenant, tous les gens, n'importe quoi, s'ils viennent hors du pays ou entre pays, ils doivent, la direction est la même de s'auto-isoler. Alors, la direction n'est pas différente pour ceux qui sont sur le vol. Tout le monde doit s'auto-isoler. Alors, c'est pour cette raison. Mais c'est aussi pour juste commencer à parler avec la public, parce que si on a beaucoup plus de cas, il faut faire ça un peu plus en catégorie de international, interprovincial, et si on a des cas dans la communauté. Mais c'est normal avec les premiers cas et c'est consistant avec les autres provinces qu'on avait un peu plus de détails pour les premiers cas. Mais j'espère qu'on n'a pas tellement de cas, mais j'imagine qu'on va avoir plus de cas et je pense que c'est important de les mettre comme ça et on va juste mettre les vols sur l'Internet.
Thank you.
Okay. Thank you.